Many health challenges on the farm can be avoided with a proper herd health management program. During the third session of the 2022 Virtual Beef School held on Monday, March 21st, Dr. Justin Kieffer, clinical veterinarian for the Department of Animal Sciences at OSU, offered a beef herd health management update. Included in his presentation were vaccination protocols for both cows and calves, discussion on how to best implement a vaccination program, and an overview of emerging beef herd health issues, including pink eye, anaplasmosis, and antimicrobial use. Listen in as OSU Extension Beef Field Specialist Garth Ruff introduces Dr. Kieffer and his presentation in its entirety.
Well, good evening, everyone. This evening, we got Dr. Justin Kieffer, Veterinarian Department of Animal Science. And this evening, he's going to talk about cow-calf health, specifically vaccine protocols. I've done a lot of in-person meetings this winter. It seems like, Doc, every time we get done with the meeting, there are questions about animal health in some form or fashion. So hopefully we can address some of those questions here this evening. So I'm going to turn it over to Dr. Kieffer. Justin, it's all yours.
All right. Thanks, Garth. Thanks everyone for that's live is listening and also going to listen later after it's recorded. If you have questions, just drop them in the chat. We can answer those at the end. Or you can email me. It's kieffer.22@osu.edu. If you need to get a hold of me or have any questions on what I'm talking about. Garth asked for me to present kind of an update on cow-calf vaccines and protocols and what we think of as core vaccines for cow-calf producers. I'm not really going to delve into feedlot stuff here all that much, but I wanted to go over the core diseases that we vaccinate for, what those are briefly. I'm not going to get too into the weeds on individual details between each disease, but what we think of as the core viral and bacterial things that we should vaccinate all cows and calves for. And then a sample of what we do at OSU, what I think of as a good routine for at least our herds. I think we have 700 or 800 mama cows spread out between all our different stations for research and teaching. So we have quite a few of our own cows, and our farms are no different than yours at home. And so we struggle sometimes with the same illnesses and things like that. So we try to match what the industry is doing. So I'm going to go over those cow-calf vaccines and the protocols, what we like to do for our mature cows and heifers. And then at the end, I have a pink eye presentation that I presented at the American Association of Bovine Practitioners meeting last year in Salt Lake City. It's a little technical, but it's a really good, I think, presentation on the current thoughts on pink eye and why it's so frustrating using commercial vaccines for pink eye, and just the approach that we've taken at one of our research stations, and given the science of what's out there in terms of vaccine protection and how it's helped us, knock on wood, at least so far with our pink eye issues. So that's what I'm going to cover today. But if you have other health issues or questions you want to ask in the chat, feel free to drop those in. So going off on the races here on our first slide, what do we think of as the core vaccines for beef cattle? What are the antigens, specifically the bacterial or viral antigens that we want to give our cattle? What are the most important? The first one, and we'll talk about these individually in the slides, is IBR, infectious bovine rhinotracheitis. Historically a big issue in cattle. Since the advent of vaccination for this back in the 70s, not as big a deal, but it's still out there. And in any of these bugs, you should always keep in the back of your mind, if we don't see any clinical disease, if we're not treating pneumonias in our calves and cows, that does not mean it isn't there. It means that your vaccines are working, and that your nutrition is good, as your management's good. But sometimes that's going to come up and bite you, no matter what you do. And having this protection there is a really good idea. So just I go off on a tangent there, but I wanted to explain that about IBR. Parainfluenza virus, not a huge individual problem on its own. Parainfluenza virus is a really big issue for setting up secondary bacterial infections like infectious bovine rhinotracheitis and BRSV. The third one, BVD, bovine virus diarrhea, still a big issue in the beef business. We still see lots of persistently infected calves, and we'll talk about those and the impact on immune suppression and feedlots, and also has a big impact on reproduction for mature cows. Bovine respiratory syncytial virus, still out there. As a former dairy practitioner, I was in private dairy practice for 6.5 years. I fought BRSV a lot. I've seen it on feedlots as well. We actually had it on our campus dairy here not too long ago due to a biosecurity break. Even though we're really well vaccinated, we still lost a few cows out of that outbreak. So BRSV is a notorious viral pneumonia illness in cattle, and still causes lots of damage. So, and I'll give you my thoughts on how we protect against that. And then in terms of the Clostridial vaccines, we think of as core, that would be Clostridium perfringens, type B, C, and D. So 3 different types of perfringens that we worry about. Clostridium shovii, novii, septicum, and sordelli. And we'll talk about those individual antigens when we get down to the Clostridial part. But those are the bugs that I think that every cow and calf should be vaccinated for. And then we can talk at the end about ancillary or risk-based vaccines, whether we need to use them or not, and what we use in our herds as addendums. But these are what I think that every bovine animal should get at some point in their lifetime, hopefully multiple times in their lifetime. So BRSV, bovine respiratory syncytial virus. I'm going to show you lots of slides here with pictures on them. Here at the top is a set of lungs. Looking down from the top, here's the trachea and esophagus. The front part of the lung lobes here, and in the back are the caudodorsal part of the lungs, and just a classic look from bovine respiratory syncytial virus, a major cause of respiratory illness in cattle. What we see typically in BRSV outbreaks are high fevers, so 104, 105, 106, they don't want to eat. Hypersalivation, and I'll show you a picture of this on the second slide, where they constantly have saliva running out of their mouth. And then they also have emphysema, or air underneath their skin, and also air bubbling up here on the outside surface of their lungs, which you'll see on necropsy when they die and you open them up. And then dyspnea, just gasping for breath. In completely unvaccinated herds, in my experience in beef and dairy cattle, you're going to have a high mortality rate. Anywhere from 20 to 30% of those cows or feedlot cattle are going to die, no matter what you do to them. If we can give antibiotics, and we do in those cases, but generally we're just trying to prevent that secondary bacterial infection that's kind of always hanging out there that we're trying to make sure we don't get. But the initial damage done by the virus is pretty devastating to cattle. How do I manage BRSV? And we'll talk about this in the vaccine protocol part of this lecture, but I manage it with modified live vaccines. So that's, we use a product twice a year in our dairy cows and once a year in our beef cows to help protect against BRSV. Historically, in my opinion, the BRSV antigens in kill vaccines don't get as much protection as modified lives. You may see some differences in opinion on that in the veterinary world. Regardless, we'd be using at the very least a killed virus vaccine for syncytial virus, and probably most likely for the best protection modified live. I've also used intranasal vaccines. I'm not going to try to delve into too many products that we use, but we use some intranasal vaccines in our calves and our cows, calves at birth, and then in cows in the face of respiratory outbreaks when we're moving them, and that provides some really nice protection to actually prevent infection. One of the things you need to realize when we're talking about vaccines is that most vaccines don't prevent infection. Many of you have probably noticed during the COVID outbreak here in the last couple of years that people have been vaccinated and still get coronavirus. I was one of those people, triple vaccinated and still got coronavirus. That's not the expectation of most respiratory vaccines. It's a very tall order to ask our vaccines, whether they're in humans or in cattle, and horses, pigs, to actually prevent infections. It's really to prevent disease and death. And a lot of our vaccines work really, really well. So keep in mind, read the label on the vaccines, and it'll tell you aids in the prevention of disease doesn't necessarily prevent infections, with a few exceptions from our intranasal vaccines. So getting back to BRSV signs, the classic sign that I see, and this is what I saw in our dairy cows here about a month or so ago on campus, we had some subcutaneous emphysema. So you can walk up to our cows. Here, this is a Holstein. You can put your hand on them, and it feels like bubble wrap. And that's air that has escaped from the lungs due to all the damage that's occurring in the lung tissue and going underneath the skin, and then of course rising up to the top of the back. These are cows that are typically very sick and struggle with breathing. Picture this Hereford here with BRSV. It's hypersalivating, so it's frothing at the mouth. A lot of that saliva is dropping out, and it's open mouth breathing. So if you see an animal like this in severe distress, they're not doing very well. That's pretty classic signs for a BRSV infection. When it comes to IBR, okay, Again, we've had vaccines for IBR for several decades, but it's still out there and still causes viral pneumonia in cattle. A lot of similar signs to bovine respiratory syncytial virus. So we're going to see high fevers, anorexia, cough. We will see some hypersalivation, but we're not really going to see that air under the skin, the emphysema that we do with BRSV. We can also see additional signs with IBR, such as red nose. Those are the erosions on the nose, oral erosions inside the mouth cavity, and then abortions in pregnant animals. This is a common sequelae or side effect that we see in pregnant beef cattle that are naive to IBR. They get infected, and then the IBR virus actually attacks the corpus luteum and the reproductive tract, and they lose the pregnancy. Also a risk when we have beef cattle that are not properly vaccinated. We're using killed virus vaccines. They're pregnant, and then we give them a modified live. While they're still pregnant, we're at risk of causing pregnancy loss there. It's a small risk, but it's still there. So something to keep in mind with IBR. IBR can also show some pink eye-like lesions too, some edema of the cornea. Here up in the upper right-hand side, it's dinner time, so hopefully all of you aren't eating dinner as you're watching this, but I'd like to show you what actually happens inside the trachea of a cow that has BRS or IBR. This is the cut surface, so we've cut it lengthwise down the length of the trachea and just split it open. And the inside of the trachea is all red and highly irritated and sloughing off into the lumen or the open airway. So you can imagine this animal was trying to breathe and it wasn't very successful. They basically choke and asphyxiate on all this material coming loose within their trachea and then falling in the airway and clogging it up. So it's not a great way for the animal to die. In terms of antibiotics, we do use these in IBR infections. It's really to help with the secondary bacterial infections that we'd expect from Mannheimia or Pasteurella that's hanging out in the upper respiratory tract as a normal inhabitant. But vaccine, really key for IBR prevention. Just here's some pictures here. The classic red nose lesions of infectious bovine rhinotracheitis you see all over top of the nostril. Makes that animal super painful. They're not going to want to eat and press their nose against the grass or any forage or dry hay. It's going to be really irritating for them. You also may see lesions inside the nose or inside the cavity in the buccal space here where the jaw is. So pretty classic signs of IBR. Also, you'll see some corneal edema. So this is basically the clear part of the eye that gets a bunch of fluid attracted to it as the virus attacks the cornea itself. Not a true pink eye or bacterial infection. This is just a viral side effect from the IBR infection. The next bug we really want to vaccinate for in beef cattle, I think, is core is bovine virus diarrhea or BVD. And some of you may have heard people talk about BVD, persistently infected or PI cattle, and the impact on the industry. And it is still a significant driver of immune suppression in the beef industry. Again, we're talking about a diarrhea virus, so it's not a direct cause of pneumonia. BVD does not go to the lungs and cause pathology. It goes to other parts of the body. And we'll talk about those and the damage that happens. We have two different types, type 1 and 2 type BVD. So I'm not going to quiz you on those different types. I'm just going to tell you that there are some different strains out there. We have a cytopathic strain, which causes these oral erosions. It causes diarrhea, severe clinical signs, high fever, anorexia. Not seen very often, but we don't have the risk of getting PI infections if we have a pregnant cow that comes down with a cytopathic infection. But again, this gets producers, especially veterinarians, very excited when we see oral erosions. We think foot and mouth disease viruses. Usually when we see these outbreaks of cytopathic virus, we're going to have to call the state vet in and do some special diagnostics to confirm that, yes, indeed, it's not foot and mouth disease. But that's what cytopathic BVD looks like. The one we really worry about is the non-cytopathic BVD. So cytopathic means it causes cellular damage. So here we have no cellular damage apparently on the animal when they get infected, even though they may have a high fever. This is the biggest risk for getting persistently infected cattle. No apparent signs. A persistently infected calf, in the process of how that happens, actually, you have a pregnant cow, let's say about 120 days gestation, maybe less. The fetus is growing inside her uterus. It's starting to learn which part of its body is self and which is non-self. So self and non-self, and it gets an infection. The virus seeps through the entire body of that calf. The calf recognizes that virus as self and not foreign. The calf could be born normally, look completely normal, and shed BVD virus from its saliva, urine, feces, all of its normal body excretions for the rest of its life. And that is a persistently infected calf. And that calf may be born normally, wean normally, have no outward signs of being ill, and spread that virus all the rest of its pen mates. And if it goes into a feedlot, it will spread it to the rest of the cattle out there too. Clinical signs of these non-cytopathic strains pretty variable. You could have nothing, you could have fever, anorexia, you may see some diarrhea, you may see some mucosal disease, but that's not as common. We get the pregnant cow. So like I just described, we have the cow that gets pregnant with BVD or gets pregnant and has BVD infection. If it's early gestation, so remember that gestation is about 285 days length from the time of conception to the time of the calf. Up to about 30 to 45 days, we're going to see just general pregnancy loss. And this is the issue, especially on dairies and very intensively managed beef operations where we're doing artificial insemination. If we have a BVD positive PI, persistently infected cow or calf walking around, they're shedding this virus out and challenging even our vaccinated cows. We can see early embryonic death and issues with pregnancy rates, which is a huge issue, especially on the dairy business. And then we get infections from anywhere from 30 to 145 days. This is a persistently infected calf that I talked about. Later in gestation, 150 to 180 days, we're going to see abortions, stillbirths, or other congenital defects, and I'll show you some pictures of those. And then 180 days plus, that calf's typically going to recognize that virus as foreign and fight it off, but that calf may be set up for illness after it's born. So why do we care about BVD so much? It's just a simple virus that causes diarrhea and some erosions on the nose. Well, when it happens, we get these pen mates that are infected. They spew this virus out of all their bodily secretions. BVD is highly immune suppressive. Okay, what happens when an animal gets a BVD infection is that its white blood cell counts drop dramatically. We know this through research by experimentally infecting calves and cows and looking at their cell counts after they've been infected. They absolutely crash, and those white blood cells are critical for maintaining health and preventing upper respiratory tract infections, especially secondary ones that are coming from Pasteurella mannheimia. We also see thrombocytopenia, which is basically a drop in blood platelet count. So they have issues with bleeding. They don't clot very well. We don't have the white blood cells that do circulate around in the body going to sites of infection. So we have what we call chemotaxis. So this is the signaling that comes in and says, hey, I have an infection in my lungs, come kill it. That is decreased by BVD during infections. And then interferon, this is an antiviral compound that's naturally secreted by cells during viral infections. Its production is decreased. So BVD is a kind of a quadruple whammy to the immune system. That's why we don't like it in our herds. So how do we manage or eliminate BVD? We need to test calves prior or on arrival for persistent infection. So if the calf is persistently infected, every cell in their body will have BVD, which we could look at for immunohistochemistry. Here in this slide here, they're taking a ear notch out of this calf. This is a pig ear notcher. I have one in my truck too. We do it all the time to check for persistently infected calves. You check the notch. You can actually pool the notches in 5 to 10 samples per bag and send them off for analysis. You could also draw blood samples to look for persistently infected calves. And if you find the calf, it should go to market. It's not a human safety issue. It can be marketed for meat or can be euthanized on the farm. It's not an animal you should keep around if it's persistently infected. The best protection is modified live vaccination for BVD, and we'll talk again about that in the vaccine schedule. The modified live vaccines in my hands and beef and dairy cattle have been very protective in reducing or eliminating the risk of BVD persistently infected calves. And then source calves and cows or replacement females from herds that have documented vaccine regimens. Don't just buy cattle from someone that says they gave their cow shots. Okay, what are those shots? When did you give it? Did you give a modified live? Because that's going to provide the best protection for BVD virus. Here's just a nice graphic. I use these in my courses as well here at OSU. Let's say we have a persistently infected calf here. They could spread that to another cow in the herd who has a fetus on board that could become persistently infected themselves. They could suffer acute infections, like I talked about, that really drops down our pregnancy rates, especially early on within the first 45 days. Bulls can get infected and certainly affect their fertility as well. And then if we take these calves and wean them, and we have a PI walking amongst them, if we vaccinate these calves, the risk for them for getting respiratory disease and immune suppression is far higher, even if we vaccinate them. If we have a PI running around shedding millions of virus particles for every cc of saliva or feces that they drop out. So it's kind of devastating to have one of these PI calves around, something that you don't want. The last virus antigen we'll talk about is parainfluenza virus, or PI3. Clinical signs include fever, lots of eye discharge or lacrimation, nasal discharge, depression, and coughing. Typically milder signs with PI3 versus BRSV or IBR, so not the typical raging viral pneumonia that we would see with those other two bugs. If we don't have any other infections going on, we don't have a secondary bacterial infection, typically the calves recover without too much damage. It is a virus that does not spread outside of the respiratory tract. So unlike BDD, it does not go into the GI tract. It does not affect the uterus or in any way, similar to what IBR does as well. So just stays in the upper respiratory tract. It's really associated in our experience with co-infections with IBR or BRSV. So they may have both IBR and PI3 at the same time, or BRSV and PI3 at the same time. But it's a really big setup virus for the secondary bacterial infections, so Mannheimia, Histophilus, Pasteurella infections that come in after the viral infection is done, when the damage is done, to cause even more further illness in the lungs. And the best way to prevent PI3 is to vaccinate, and there's some good vaccines out there. Moving on to the Clostridial diseases. These are gram-positive, so they stain a dark purple when we put them under the microscope slide. These are normal GI flora. This means they're in their GI tract probably within hours after they're born, when they start to ingest material from their environment, get some dirt off mom's udder when they go to nurse. It's going to stay in their GI tract for the rest of their life. Same is true for lots of other animals, including humans. We have Clostridial bugs in our gut as well. They're all over the place. They're all over the soil. They're all over the environment. Generally don't cause too many issues. They are what we call opportunists. So they're looking for times of stress. That can be the stress of weaning. That can be the stress of bad weather. That can be the stress of nutritional changes. If we're changing from forages to concentrates or back and forth. If we have mold in our feeds, other types of stressors really give us the highest risk for Clostridial diseases. And it's really not the Clostridial bacteria themselves that cause the damage, unlike E. coli, which latches onto the gut and causes a whole bunch of damage to the GI tract and makes the calves really, really sick and get in the bloodstream, cause lots of issues. The Clostridial bacteria themselves aren't the problem, it's the toxins that they secrete. And that's actually generally what you're vaccinating for when you give a Clostridial 7 to 9 way, your Alpha 7 or your Ultrabac 7, whatever that is. You're vaccinating against the toxins that those particular bacterial strains produce. That's the thing that we're vaccinating for. In my experience, and those of you that have seen blackleg cases or Clostridial enteritis cases, pretty frustrating, right? You go out and you just find an animal dead or a few animals dead, okay? Not a lot seen before they die. It's usually a very quick burst of Clostridial growth, wherever that may be. If it's enteritis, it's in the GI tract. If it's in the muscle, it's blackleg, and then they die. The vaccination part of this is really key for prevention. There's not a lot of time for us to catch these animals with a fever, catch them feeling off, ears down, moping around, maybe lame if they have blackleg. Even if we do catch a lot of these animals, in my experience, I have caught some Clostridial perfringens cases. I don't save very many of these animals at all. They're very, very tough to bring back because it's really hard to find antitoxin to actually treat those diseases. And if we get antibiotics on board, hard to get the antibiotics to the site of infection anyway by the time the infection has progressed. So vaccines are cheap, readily available for lots of different Clostridial diseases, and I would highly encourage you to give those. We'll talk about what those examples are. Blackleg, tetanus, not a core vaccine. We'll talk about what it's core for in the cattle, but not for all cattle per se. Enteritis, which is the perfringens issue, and then red water. Talk about that. So Clostridial diseases, the ones that I recommend vaccinating for are the Clostridium perfringens. These are B, C, and D. This is enterotoxemia. Entero means the gut. Toxemia means toxins in the gut. So this is an overgrowth of perfringens bacterial populations within the gut, generally due to stress of changes in feed, in my experience. So these are young calves that are going from being on mom, maybe nibbling on some grass, and then we may slam that with a bunch of fines, a bunch of concentrates, and we may see some Clostridium perfringens overgrowth. Or during the stress of weaning, they may go through some GI changes, they may go off feed, especially if we truck wean them or ship them without any preconditioning. They set them up for stress, and we can see Clostridium perfringens rear its ugly head. Clostridium shovii, blackleg, historically an issue all over the country in certain parts of the regions of the United States. Again, an issue of lack of vaccination. Not only do we have Clostridium bacteria in the GI tract, you can also have bacteria that seed out through the muscle tissue, and this is what happens with shovii. So if we have an issue of stress or of a wound that causes low oxygen tension, which is where Clostridial bugs like to grow. They don't like to grow in areas with high oxygen. They like 0 to low oxygen. We can have blackleg issues. I've seen some pretty ugly outbreaks of blackleg actually in dairy heifers, where we've actually used a bottle of glutamate that became contaminated with Clostridium. We injected it into a bunch of heifers. Obviously, when you give a hormone like glutamate, it causes constrictions in the veins and the blood vessels, low oxygen tension, then we get growth of Clostridial bugs, and we see a bunch of blackleg. That was kind of a terrible issue I dealt with in private practice. So keep your bottles clean, vaccinate for blackleg. Clostridium septicum, that's a malignant edema, typically causes swelling of the chest and fluid accumulation in the chest cavity and in the heart. Sordelli is a bug that's mixed. You can culture Clostridium sordelli out of Clostridial enteritis cases, so out of the GI tract, and also from blackleg cases. And then Clostridium novii is a necrotic hepatitis. It's not one that I've experienced in private practice, but it is out there, and it causes a pretty damaging liver infection that eventually kills the calf or the cow. Here's some pictures. Again, here's a classic picture of blackleg. Here's another cut muscle section of blackleg. So typically I've seen it on the legs or on the hips of beef and dairy cattle. Low oxygen tension again, so no oxygen there, which makes the Clostridial bugs overgrow. They produce their toxins and the animal dies. Here's a picture of enteritis. So these are animals that can be found dead. We open up some of these animals like here that are quite bloated pretty quickly. We open up the gut, pull out the intestines, and if you were to open these up with your knife, they would be filled with the red frothy fluid. That's classic for Clostridium perfringens type overgrowth. So for those of you that have hunted before or butchered cattle or have eaten heart before, you'll recognize this as the heart of a cow. And this is actually the heart from one of our cows at our Eastern Research Station from about 3 or 4 years ago. And if you remember then, that winter of 2018, 2019, we had a lot of rain. The cows at our stations, and I know across the state, did not look good coming out of the winter from standing in the mud all winter long, and rather poor condition compared to what we're used to. And we had some cows die in one of our research units that we really couldn't figure out what's going on with them. We just find them dead, which is kind of a classic sign for Clostridial disease. So we finally caught one that had freshly died. We had some suspected issues. We thought maybe it could be toxins, maybe some old material the cows got into in the pasture, or some other weird toxin they may have get into the environment, or maybe Clostridium. So we opened up a cow. This happened to be a red Angus cow that we found dead, and we found this in her heart. So this is a cross section of the heart of a cow. Here is the left side of the heart. So this is the side of the heart that pumps the blood to the rest of the body. This is the right side of the heart that pumps the blood to the lungs to oxygenate it. Okay. And here along the cut surface of the ventricles here, all kinds of little dark areas of streaking. These are hemorrhages. So this cow died of a Clostridium septicum infection. And the toxin from Clostridium septicum caused all these little hemorrhages all throughout the cow's heart. And this is what she eventually died of, was the damage the ability for the heart to contract. And she basically died of a heart attack at that point. So this is a cow that had been vaccinated twice as a calf, once as a replacement heifer, and twice yearly as a mature cow. And we still saw an issue with Clostridium. So no matter what we did, we had her well vaccinated, but the environment presented us with a challenge that winter. And we lost about 5 cows to what we suspect was Clostridium infection. So we actually went ahead and boosted our cows, gave a 3rd dose out of cycle due to help the stress on the cows and to provide some extra boost for protection for the cows. So just an extra step we did to provide more protection. So just goes to show you can have doing everything right. We'll be a well vaccinated herd, and the environment can just throw you a curveball, and sometimes you just got to adjust and react to that. Clostridium tetani. So tetanus, I don't consider to be a core vaccine for all cattle, of course. It's essential, however, for bulls that are being banned for castration. If you're putting a ban on a bull, I don't care if it's a 1,000-pound bull or one that was just born on pasture, and you're banning them right away, which is great. I think that's a good idea. If you're not going to keep bulls around, put a bands on their testicles as soon as you can. It just saves a whole lot of issues than versus castrating that calf when it's 400 or 500 or 600 pounds. But if you're going to put a band on them, make sure they get a tetanus vaccine. Now, in an ideal world, would I want to vaccinate at the time I put the band on? No, because when we give vaccines, they don't work right away, correct? They take time for the immune system to take that antigen. In this case, it would be tetanus toxoid, or an altered tetanus toxin that they've heated or treated with chemicals to alter it, but make it still intact. That your immune system can see that toxin, make antibodies to it. So if you get a tetanus infection, it can fight off and send antibodies in to cover up that tetanus toxin. So it takes about 17 to 20 days for your immune system in humans and also in cattle to take antigens that we inject from vaccines, usually in the shoulder or in the arm, to the lymph nodes where the antibodies are made, and for those antibodies to get out into the circulation. Okay, so if we're giving a band on that calf and we're giving a shot at the same time in the chute, we're kind of hoping that that calf's not going to develop tetanus within the first couple of weeks. Ideally, I'd like to bring the calves in a couple of weeks prior, give them all a dose of tetanus toxoid vaccine, then bring them back a couple weeks later and ban them. Does that work in every system? No. Is that an extra step I'm asking as a veterinarian for a producer to do? Yeah, it is. That's an extra processing step, and we don't always get calves up for that. So, worst comes to worst, if you're going to run the calves through the chute once and ban them, please give a tetanus toxoid. It's not perfect, but it's better than nothing. You can co-administer a tetanus antitoxin at the same time as you ban, and that will provide temporary protection for about 90 days. And if you co-administer a tetanus toxoid vaccine at the same time, you can give that vaccine time to work, time for the immune system to generate antibodies. In the meantime, if you've given an antitoxin, which is a passive type of vaccination, it can provide protection that will slowly drop over time as the calf's immune system makes its own antibodies. I've come into Rex where we had 800, 900,000-pound bulls that have been castrated with large banders like cattle crate banders. And it's really sad to see, a huge animal like that laying on its side, stiff and not able to move. I don't save any of those type of animals when they get to that point. These issues also are seen in mature cows. This is a dairy cow. I've seen 3 or 4 dairy cows in my experience that actually had tetanus. It's not a typical core vaccine for cows. It's very rare to see mature cows with it. And what happens is these are cows that have recently calved, that they've developed a uterus infection. The uterus infection has become walled off. The cervix is closed. So we have a no oxygen environment again in the uterus. We get a Clostridium overgrowth and they get tetanus. Here's just the classic case that we see in cows is hunched up. If you would had a better picture, you would see her diaphragm. She'd have a heave line from all contracting her diaphragm muscles all the time and her abdominal muscles. So a pump handle tail. So her tail's constantly pushed up all the time. If this was a live video, you would probably see her third eyelid flicking over top of her eye. In this case, it's probably a cow that needs to be euthanized. When these animals do die from tetanus, it's not a pleasant death. It's basically a conscious suffocation. They're going to lay down on the ground when they get stiffen up that they can't move their leg muscles. They can't move their diaphragm. It stops moving, then they stop breathing, and then they die. So not a great scenario for them. So vaccination really key for tetanus prevention. Not a core for all cattle, mainly for calves that are getting banded. If you're dealing with tetanus cases in your mature cows, then it's probably a good idea to think about including that into your vaccine regimen, but generally not a core vaccine for most beef cattle. Those were the core vaccines that I talked about. In terms of risk-based vaccines, these are situational based type of vaccines that we use depending on typical bugs that we're fighting in any given scenario. E. coli is one of those. We have injectables for pregnant cows. So these are killed bacterians, or sometimes they're subunit vaccines. So they're basically the outside pili or connection between the bacteria and the host that they take from the bacteria and adjust it and kill it, and then put it back in a vaccine and inject it into cows. And that can be given to pregnant cows late in gestation. So let's say 4 to 6 to 8 weeks before they calve. We give that vaccine late in gestation. She can actually take that vaccine, make antibodies for herself, and also generate antibodies that she's going to put into her udder. Hopefully you all know understand the importance of colostrum. Colostrum is IgG. It's pure immune globulin that the calf needs to get from mom after they're born. She can provide protection for E. coli infections for her calf by the calf getting colostrum for her after she's been giving E. coli. We also have some oral boluses for calves. The first defense bolus is really nice for calves in scenarios where we're having outbreaks of E. coli infections in calves less than a week of age. In those scenarios, those oral boluses provide localized protection in the gut right away, very safe, and to give those calves. If we inject those young baby calves with E. coli vaccines sub-Q or in the muscle, they're very young, their immune system's naive, and it takes them a long time to generate an immune response. So that's why we typically go for the oral immediate protection for those calves, and then look at the mature pregnant cows and start vaccinating before they calve in the future to prevent that issue. Rotavirus and coronaviruses are typically packaged with E. coli vaccines. There's Guardian, Scour Boss, or Scour Guard. There's several different products out there that usually combine E. coli, rotavirus, coronavirus, and Clostridium perfringens type C all in one bottle, so 4 different antigens. I will say my personal experience here recently, we've had some rotavirus issues in our 2-year-olds. At one of our research stations, we hadn't seen that issue before. We had some rotavirus infections. We did lose a calf, brought a few back from the dead with some IV fluids and some electrolytes. Did some testing and figured out it was rota for some reason, which we had not fought before in our herd. So we, in the following year, we instituted a E. coli, rotavirus, coronavirus vaccine to our heifers before they calved, and boom, we don't have an issue with rota. At least we didn't in the past few years. So it's been beneficial. The bacterial issues. So Mannheinia, Pasteurella, Histophilus, these are the bacteria that are normal upper respiratory tract inhabitants. So if you were to take swab samples of the nose and the pharynx, which is the back of the throat, in cows, you will find these bugs in very healthy cows and healthy calves. In research scenarios, I know researchers that I know that have studied, especially Mannheinia and Pasteurella, Histophilus, they've injected millions of these bacteria into the nose of cows in studies and not caused any harm. Okay, they're always there, growing around, not causing any harm. But if there's a viral infection or stress or some other issue that sets up in an area where the Mannheinia or Pasteurella can explosively grow, then we're going to see issues with those bacterial infections from these 3 bugs. Are there vaccines for these? Absolutely are. Some of those you may have used, like One Shot, things like that, that are out there in terms of vaccine products. The evidence in the literature for their efficacy or how well they do to prevent disease and death from these bacterial infections of the lungs is very limited. In my experience and looking through the literature, it's really mixed. It's hard to find a good study that says definitively, yes, this Mannheinia vaccine or this Pasteurella vaccine does prevent disease and death. I'm not saying don't use these vaccines. In cases where we're having outbreaks, I suggest we use them. Just understand there's just not a lot of data to support them in terms of the literature. We just need better studies. That's what we need. And then Salmonella, if you've dealt with Salmonella Dublin or Salmonella typhimurium, or one of the Salmonella strains out there, they're nasty. They cause illness in calves and cows, cattle of all ages. And there are some good Salmonella vaccines out there that you can use in the face of an outbreak and help break the cycle within your herd. Other risk-based vaccines, lepto, we don't consider necessarily core. Not every beef operation uses lepto, although in my experience, most of my herds do. All of our herds actually at OSU do. There are several different strains of leptospira bacteria, the Canicola, Griffitophosa, Ictohemorrhagiae, Pomona, and Harjo bovis. Most of those 5 ways come packaged together, or there may be 4 packaged together. And those are fine to use in conjunction with our Clostridial vaccines. And I'll talk about how we use those on our own herds and on our typical vaccine protocol. Lepto causes abortions and generalized systemic infections of fever and urinary tract disease. Can also cause reproductive issues, although that hasn't really supported by the data as of late. Lepto, not considered core, but very, very common to be added to most of beef and actually dairy cattle vaccine regimens. Clostridium hemolyticum, this is a Clostridial bug that causes issues with red blood cells. Not a typical issue in Ohio, so I don't really recommend vaccinating for Clostridium hemolyticum unless it's already included in the products you buy. That's fine. Just not a huge issue in the state of Ohio for us. Marxilla bovis pink eye. I'll talk about my thoughts on pink eye and what we've done. The commercial vaccines out there, the Vision 7 2020 and the MaxiGuard. There's other commercially available marxilla bovis vaccines, not so efficacious, and it's really been frustrating as of late to try to deal with pink eye. Mycoplasma bovis, there are some labeled products out there, some vaccines for mycoplasma. No evidence in the scientific literature that they provide protection from disease and death, but I understand why some producers might use them. And then brucella, so bangs vaccines, still common in the dairy business, but I'd say declining in popularity due to the cost of the vaccine. Lots of producers around the Yellowstone area where there are brucellosis infected elk and bison, they are required to vaccinate, or they do require vaccines prior to importation of cattle into that area. Historically, brucellosis has been nice to use to facilitate sale of cattle around the country and also for export. Although it seems like now when I sell cattle from our herds through sales, they require brucellosis testing anyway. They don't really care if they're vaccinated or not. So I think the need for brucella vaccination is waning in the beef business and definitely in the dairy business. So, but that's still an optional risk-based vaccine. So we get to actually, what do we give and when do we give it? When it comes to, when we start at the beginning, we start at the calf here. I really avoid giving injectable vaccines. So those are the modified live or killed vaccines. That's the titanium, the express, the bovis, the cattle master, whatever you're using. Giving that to a newborn or a calf that's a week old or a month old, generally not a good idea. If we assume that mom here cleaning off the calf, she's been vaccinated. If we're a good herd that's been vaccinated her cows once a year with a modified live or twice a year with the killed virus, she's going to have IgG in her system. Immune globulin or antibodies, she's going to give it to the calf at birth. Okay. When the calf absorbs those maternal antibodies, so ideally that calf should get up, hopefully within an hour or two, have absorbed several pints or a gallon or so of colostrum, which is awesome. They can absorb all that IgG. It's going to circulate throughout their body. Okay. If I give an injectable vaccine at that point, days or weeks later, all those antibodies that are present in that calf system may counteract the vaccine antigens I'm injecting. So the IBR or BRSV antigens may be counteracted by what the cow gave the calf. So that's why we just say avoid giving those injections for the most part before 4 months of age. Okay. Also, BVD virus vaccines, the modified live ones I'm speaking of, while these are modified, okay, these are BVD viruses that we've taken in a laboratory. The vaccine producers have taken the BVD, took it through 20 or 30 tissue passes where they basically take the BVD virus and grow it in rabbit's blood, do it 20 times. Okay, the virus mutates a whole bunch of different ways, loses its ability to cause disease in cattle. Great. We can inject that into a cow and we can get protection without causing the cow to get sick. However, when we give those BVD vaccines, it can cause some immune suppression. Okay, that virus is, while modified, it's still alive. That's the last thing I want to do to a little newborn calf is suppress its immune system, even if it's a small or short temporary immune suppression. They're new, they're young, they don't have experience in their world, their immune systems aren't so strong yet, so I don't want to immune suppress a calf. That's another reason why I don't want to give those parenteral intramuscular or sub-Q vaccines to a young calf. Okay, I'm going to wait till those maternal antibodies are gone, 3 to 4 months of age, before I start thinking about giving them injectables under the skin or in the muscle. Here's just a nice graph here. On the left-hand side, we have grams of antibodies. So this is just basically IgG that they get from a cow, from colostrum or colostrum replacer if the cow doesn't have any. Okay, we're going to give colostrum 4 quarts ideally, or a gallon. It's going to be ideally really high concentration for the first several weeks, and it's going to wane. Okay, there's a point in time, there's that window of susceptibility. Here, I think this graph could be extended out much farther than 8 weeks. We get some longer duration of passive immunity, but at some point, the passive immunity of the immune globulins that the calf got from mom are going to be degraded. They're going to be eliminated, and the calf's going to have to start making their own. That's where we're going to need to step in with our vaccines and give them. So it's not going to be a perfect scenario. We're not going to have high protection at all times, but we're going to get hopefully good protection. We're going to get good colostrum from mom, and eventually we're going to come in with our vaccines 3 or 4 months later. Okay. What do I do recommend for the newborns? So starting from the beginning, if we have issues with newborn pneumonias, we have cattle that are going to be moved around at a young age. The intranasal vaccines, Enforce 3, Nasogen are the 2 ones that I've used. They provide immediate protection from infection. These are what we call mucosal vaccines. So we're giving it in the nose, in the mucous membranes. This sets up a local immunity. It's not going to go through the rest of the body in general, although they do communicate. The body does have memory from mucosal vaccines systemically. You can find it in the regional lymph nodes here, like in the throat. you could actually find antigens for the vaccines you've given in the nose later. We've seen that through research. But again, it's a localized protection from infection for at least 90 days. Okay. There's also some things that come along with these vaccines, not only the antigens, but also what's called interferon, which I spoke of earlier. That is really a non-specific antiviral compound that can actually prevent virus attachment and virus spread through the upper respiratory tract. So not only do you have the vaccine antigens that you can make immediate IgA, which is the type of immune globulin we have in the nose, but you can have that other antiviral compound right in the nose. In my experience, these products have been really beneficial in the face of viral pneumonia outbreaks. Just if we have it going through the calves or the cows, we just go ahead and hit everybody with intranasal vaccines. They're very safe. They're not going to be affected by the maternal antibodies at all, like what we're concerned about with the injectable vaccines. If we're dealing with early bacterial pneumonia in calves, I would also look to see if those bacterial infections are being set up by something else, either some BVD creeping around or some clinical viral infections. But you can use the intranasal once PMH has been helpful in my experience. And then if we have E. coli outbreaks going on in our calves, we probably have to wait for the next year to vaccinate our cows and deliver it to the next batch of calves. But in the meantime, if we have outbreaks of E. coli in the first week of life, those oral first defense boluses are pretty helpful to prevent further E. coli infections in the calves that aren't quite sick yet. So, calf vaccination strategies. So core, you can consider this important if you're dealing with those early viral issues in calves. An intranasal vaccine at birth. I would say just a few of our herds do this. Not all of our herds at OSU give immediate vaccines at birth, but they're pretty helpful. These vaccines contain IDR, VRSV, and PI3. These intranasal vaccines do not contain DVD, which I would be worried about causing immune suppression. Then we're going to wait till they're 3 to 4 months of age. And we're going to give a modified live or killed pneumonia vaccine. So that's going to be our VRSV, BVD, our PI3, and IDR viral antigens. Okay. A lot of times they're combined with an optional leptofibre. You can find them without the lepto. We tend to just give them anyway with the leptospira. And then we start our Clostridial vaccines at the same time, a Clostridial 7-way. All those giving at the same time at 3 to 4 months of age. Okay. Once that calf has had that first dose, we need to wait. We can't come in a week later or 2 weeks later. Okay, we need to come in at least 3 weeks, because remember what I said earlier in the presentation. We give shots, or when you got your coronavirus vaccine, and I hope you're vaccinated, you get your vaccine, it takes time for your immune system to take that antigen from the site underneath your skin or in your muscle, to take all that antigen, take it down to the lymph nodes where your B cells, which are some of your white blood cell populations, are going to make antibodies to those antigens that have been injected into you. And the same is true for cattle. That process takes, like I said, 17 to 20 days. So we just round up to 3 weeks. Okay. It doesn't necessarily need to be at 3 weeks. It can be several weeks or 2 or 3 or 4 months later. We can stretch out that time and still get a nice booster response. But again, that booster is really important to give, no matter what you give it, as long as it's 3 weeks later. We really should try to optimize giving those vaccines prior to weaning. Sometimes it always doesn't work that way, given logistics or when we're processing calves, and even in our own stations, we struggle with that sometimes. Sometimes we wean calves that only had 1 dose, and that doesn't mean I'm very happy, but we're going to deal with it. We're going to give the second dose after the calves have gone through the stress of weaning. But ideally, you want to give both doses before you pull them off mom. And then that means you've got 2 doses on board, got really good protection before they start balling, and when you separate them out. Optional vaccines, those first defense bolus for E. coli protection, or intranasal vaccines like the once PMH at birth. You could also consider the Pasteurella, Mannheimia, Haemophilus vaccines. Again, not much data on how well those vaccines work. Also keep in mind, if you're giving one of these vaccines, these Pasteurella, Mannheimia, Haemophilus, these are what we call gram-negative. So they contain a compound called lipopolysaccharide, which is part of the bacterial surface. This is what makes animals that have gram-negative infections like cows feel really bad. If you've ever seen a dairy cow with an E. coli vaccine or E. coli infection in her udder, they feel really terrible. They want to lay down and just die. There is lipopolysaccharide in these gram-negative vaccines that can make cows feel really bad. So if you're combining these, let's say if you're giving a Pasteurella vaccine and a Salmonella vaccine, keep in mind that stacking 2 gram-negative vaccines in one shot that may make the cow feel really bad. So when you're designing or working with your vaccine protocols, talk to your vet on which antigen you should combine, and how do we be careful that we're not giving too much of a negative impact on the cow's health, especially with these gram-negative bugs. And your vet should be able to help you figure that out. I really avoid giving more than 1 gram negative vaccine at a time. So let's say we get on down the road, our calves have been vaccinated, they're weaned, everyone's healthy. We sort the steer calves off, put them in the feedlot. Okay, we've got our replacement heifers. So how do we address that then? So if we have our heifers coming up for development, we're going to boost our heifers with a dose of the modified live or the killed vaccine. If we're using killed, BRSV, IBR, BVD, PI3, we're going to give those 4. Add in your lepto if you're using that. That's optional, and you need to boost our Clostridial 7-way. So you need to give that. This is the 3rd dose of that vaccine regimen. We're going to give that at least 30 days prior to turning those heifers out with a bull or starting our reproductive synchrony program. Here we've got a heifer getting a cedar being placed for reproductive synchrony. You want to make sure we're through all those vaccine issues, because sometimes those vaccine issues, especially the IBR vaccines, can have influence on the reproductive tract, especially the CL, that we don't want to have. We want to be through all that issues and the stress of responding to the vaccine before we expect them to go out and get pregnant. If we have naive heifers that have not been vaccinated as calves, especially, and we give them a vaccine less than 30 days prior to breeding, we can actually knock off a CL or affect their cycle. And there's documented evidence that in the literature, in the studies where we take in naive heifers and give them a bunch of IBR vaccine, and then go to breed them, 10, 15 days later, and the reproduction really sucks on those animals. So be really careful about giving it close to breeding. If you're concerned about modified live effects on fertility, I'm a big proponent of using modified live, both twice as a calf and annual as a cow. But if you want to use killed to avoid any potential effects as a cow in the reproductive tract and using modified live, you can actually start with 2 doses of a modified live vaccine, a bovis shield or express or whatever live vaccine you're using as a calf. And then when she comes up for her booster as a replacement heifer, you can start using a killed vaccine. That still provides a really good fetal protection for BVD virus. Then we boost her. So we get that, let's say we get that heifer pregnant. Hopefully she's pregnant. We're 200 days gestation, okay? 250 days gestation. We're gonna boost her, that heifer, with another Clostridial dose. So this would be her 4th dose, right, of a Clostridial 7-way. If we're using a killed virus product, we need to give those twice a year. So a killed virus for BRSV, IBR, PI3, and BVD, we're gonna give that a 2nd time annually for those cows. If we're using a modified live, we need to use that once a year. Provides really strong protection. Remember, if the virus is still alive but neutered in some way, that provokes a really strong immune response in the animal. That's why we only need to give it once. But when it's killed, we need to provoke that immune system response more frequently and update it. And also, that point there at late gestation, an optional lepto 5-way can be boosted, and that's what we do at our own herds here at OSU late in gestation. Optional vaccines, if we're talking about pink eye, and we use these in our herds at OSU, and I'll talk about that in the next presentation. It's a pretty good idea to start including pink eye at that point, especially if they can provide that protection to the calf after they're born, or like we did last year at our Eastern Research Station, add our scour vaccine, Scour Guard, Guardian, whatever that might be, that provides protection from E. coli, coronavirus, rotavirus, Clostridium perfringens to those calves after they're born. We want to give that at least 4 weeks prior to calving. So let's say the heifer's got pregnant, calved out, done great. Doc, how do I actually address giving vaccines for the rest of her productive life on the operation? So if we're giving a modified live dose vaccine, we're typically going to just give that once a year. Okay, we're going to give that at least 30 days prior to breeding, 30 days prior to artificial insemination synchrony, or 30 days prior to turning them out with a bull. We're also going to give a killed virus twice a year. Okay, so modified live once a year, killed virus twice a year. That's for BVD, BRSV, PI3, all those 4 viral antigens. And we're going to give an optional lepto 5-way twice a year and a Clostridial 7-way twice a year. Okay, so we're going to give modified live once a year for the viral pneumonia. We're going to give the killed ones twice a year. Okay, no matter whether we're using modified live or killed, we're going to do the Clostridium twice a year at least. Don't get as long-lasting protection with Clostridia. We can't get away with just single vaccinations for Clostridium once a year. We need to give it twice a year, in my opinion. So once prior to breeding and once prior before they start calving. And then the leptos can be kind of included in that time if you want to. Then optional cows, our herds, we give our risk-based vaccines, our pink eye, which has been a huge issue for us. And we give an Autogenous one, and I'll go through that in the next part of the presentation. And then we also add in a scour vaccine to our 2-year-olds. We haven't added to our mature cows yet, but we may at some point do that if we see further rota issues in our mature cows when they calve out. So that's my spiel on when and how and why we vaccinate our cows and what I think of as core for cattle. I'm going to finish up the presentation here on pink eye vaccination and in my experience with that and some of the literature I've reviewed and the presentations I've given to other bovine veterinarians on why pink eye vaccination is so frustrating. So what do we know about vaccination for pink eye? Or here, the acronym is infectious bovine keratitis, or IBK. That's the fancy name for pink eye. We have commercially available vaccines for marxilla bovis. This is a gram-negative bacteria that causes pink eye in cattle. Okay, these vaccines, these bacterins, are basically a killed bacteria that's put in a bottle, injected into those cows or calf, have not really been effective in challenge studies where we take cattle and swab marxilla under their eye and challenge them to see if they get lesions on their eyes, and also in field settings. So we're going into outbreaks or herds with historic pink eye outbreaks, and we start vaccinating with these commercial vaccines. We haven't seen any evidence that they provide protection versus just a sterile shot of sterile saline, so a control. So no evidence that they're really protective. In my experience in private beef and dairy practice and here at OSU, they really haven't been all that great. Why? You may ask if those vaccines don't provide great protection, how do they get approved? And that's a very, very important question. It may have been just very poorly run studies that were accepted by USDA, studies that weren't randomized for weight or sex of the calves or other confounding factors, or clinical trials that weren't blinded. So let's say you had a researcher evaluating pink eye in calves or not, and they weren't blinded to which calves had the vaccine and which not, which increases the risk of bias in those studies. So lots and lots of studies out there, a lot of them actually compared to some of the other diseases that we deal with in bovine. So lots and lots of research on pink eye, and not a great amount of studies that have really high quality. So marxilla bovis is the classic bug that we think of as causing pink eye, right? And we've also noticed here in the last several years that marxilla bovaculi, it's a bug that we've cultured out of pink eye cases in cattle, sometimes or usually in co-infections with marxilla bovis. We found it in these infections, but researchers have not been able to, in clean eyes that have been inoculated with marxilla bovaculi, cause pink eye. So we haven't satisfied all the research needs or coach postulates, as we like to say that, yeah, the bacteria is there, but is that bacteria actually causing the pink eye lesion? So we still think that it's marxilla bovis that's causing these pink eye lesions, not marxilla bovaculi. It's just really not a lot of evidence out there. Have I used this vaccine? Yes, I have, but the evidence, to my chagrin, was not there for its use. So did not really help in terms of the challenge studies and the field studies that were done to try to prove that the marxilla bovaculi vaccines, which are new, were helpful. So autogenous vaccine. So for those of you that don't understand the lingo or may not know what that is or may not have used one, autogenous is basically a custom-made vaccine. This is a vaccine process. This is regulated by the USDA. So all veterinary vaccines are regulated by the USDA. Human vaccines go through the Food and Drug Administration. Veterinary vaccines go through USDA. So in the case of an autogenous vaccine, whether that's a Haemophilus vaccine for pigs or a pink eye vaccine for cattle or a salmonella vaccine for cattle, whatever that may be, to make a custom one that if we have an outbreak and we don't have a commercially approved product, an approved vaccine out there, we can custom make one by sending in isolates from the lungs or the nose, or the eyes of those affected animals into a laboratory. They can culture those samples out, make us a custom or autogenous vaccine, and send it back to our herd for only our herd to use. And that's what's called an autogenous vaccine. It's limited in time frame, typically 2 to 3 years is all the USDA is going to give you approval to make those autogenous vaccines, and then you need to reculture your animals. We're using an autogenous vaccine at our Eastern Research Station right now due to our pink eye issues. Again, not a lot of evidence in the literature for that helping in the research that they've done on it. But anecdotally, in my experience and some of the other bovine vets that I've talked to across the country, these autogenous vaccines have been fairly helpful in dealing with just really nasty pink eye issues year-round in beef and also in some dairy cattle. So why did the vaccines that we have on the market don't do well? Right? Why, or if we're using an autogenous pink eye vaccine, why does it stop working? So pink eye, IDK, it's multifactorial. So lots of different issues playing into it, like bovine respiratory disease. So we have the stress of weaning, waning immunity on a calf, okay, transportation. Those are all things that are classically, implicated in shipping fever, right? So infectious bovine keratitis or pink eye, it can be lots of different issues. We have the stress of the calf being weaned, okay, we see it most severely in calves, but also cows. We have the environment, it could be hot and dry and dusty, causing lesions on their eyes. We could have long stem pastures that are causing damage. And then we have vectors like flies, and also sometimes other insects that are causing damage to the eye and spreading it from cow to cow. So lots and lots of issues that play into why we could have increased spread. It could also be due to what we call pillae heterogeneity. That's a really fancy term for a changing surface on the outside of the bug. This is marxilla bovis right here. This is the bug that causes pink eye in this screen. And these little spikes on the outside are called the pillae. And this is what it attaches to the cornea, the clear part of the eye on the cow. These are areas, these spikes or pillae are what we've historically made vaccines for cattle. So we've taken this pillae, made a vaccine for it, great, okay. That's only going to be good as long as we have that same pillae on the bacteria, right? If that pillae changes or we get a different bacteria in there, we may not have protection. And that's been the issue. There are 7 different types of serogroups of pillae. So we have 7 different strains of pink eye out there in cattle that we are aware of. We can vaccinate for a single type of pillae, and then we could get actually a change also in the bacteria. So not only can we see different bacteria come in with different pillae types that we don't have protection for, these bacteria can actually change on their own the pillae that shoot out from their surface that connected that surface on the eye of the cow, okay? That would lead our vaccine to fail. So even if sometimes if we include multiple serogroups, it makes sense. So if I'm going to make a pink eye vaccine, maybe I should make a pink eye vaccine with lots of different pillae in it, and that's great, but that can result in antigenic competition. So we're giving the immune system a bunch of antigens at once, and it may not be able to respond to all of them equally. So we may get poor or insufficient immune protection from that. This is what I was just talking about. It's a genomic inversion. So that bacteria basically changes the outside surface, throws a curveball to the cow's immune system that it can't fight off because it has a different pillae on the outside surface of that bug. We don't also know if the local immune responses in the eye, in the clear part of the eye, in the cornea, in the white part of the eye, the sclera, are they more important than the systemic area? So let's say the lymph nodes or vice versa. So we really have to figure out from a research perspective, can we give a localized vaccine in the eye and provide protection, which there's no answer for that. There's no evidence or research out there looking at a local mucosal vaccine in the eye. Is that helpful? We don't know. Or is an injectable better? We still don't have an answer if that would be beneficial to give it in the eye or give it systemically. So lots of questions still out there. Also timing, by the time we see vaccines being administered in pink eye outbreaks, it's in calves and the damage is already done. Also the antigenicity, sort of the ability of the immune response to kick up after we give the shots sometimes are not great. We don't see great rises in antibody levels after we give the shots. If we have vaccine trials and lots of herds that I've known that have gone through these in research basis, we just don't get enough cattle in those sample sizes to get a good study. That's been an issue in cattle pink eye research. How do we approach pink eye control? So if we have these really crappy approved vaccines and we still have a really bad pink eye issue, how do we keep it under control? Vector control, number 1. So control flies. So not just fly tags, but also using porons, using dust rubbers, oil rubbers, removing spoiled feed. That is a big issue I see with beef and dairy cattle operations. If we have spoiled creep feed, calves that are in dairy calves that are in hutches, and we're just dumping out the creep feed on the ground, that is a great place for maggots to grow. We need to get that feed eliminated, composted away from the cattle. Also removal of manure, especially in feedlots or cows that are dry allowed in the wintertime, get rid of that manure. When it starts to get close to spring, that's going to be a great place for flies to grow. Clipping pastures at least a couple times a year in the summertime to reduce those eye injuries from weeds and long stem forages. And those kind of issues. And also, if we're feeding, make sure our hay racks and stuff are at eye level. They're not above the level of the cattle, so they're not having debris dropping into their eyes when they eat hay or other forages. We should continue to try to use these autogenous products, and I'll explain the process that we used at our research station at the farm level. So the historical research out there says these autogenous projects products don't work very well, but in my experience, it's worked for us for the last 3 years. In the experience of other veterinarians, it has, not all of them. But it's a really good idea to try these if you're really struggling with pink eye. There are several different labs out there that will make you an autogenous vaccine. There's Addison Labs, Newport Labs. We happen to use Addison, it's just who we picked. One thing you need to be careful of when you're working with your vet and picking out a custom pink eye vaccine is some of these labs have a minimum dose requirement. So they may want you to buy 150 doses. They may want you to buy 2,000 doses. So you have to calculate how many doses can you use in a year, and let's find a lab that can match that so it'll work out well. And then you need to renew your cultures every 3 years. And we just renewed our cultures for our Eastern Research Station cows because our 3 years were up. So we had an issue at our Eastern Research Station several years ago. We had about 325 Angus cows there. We had an ongoing issue with pink eye. It was the #1 reason why we were using antibiotics on the farm. Not for pneumonia, not for foot rot, not for other issues, not for diarrhea. It was for pink eye. And I recognized that summer because I had been asked to drop ship a second case of 500 ml LA200 to the farm. And I was like, wonder why we're using so much oxytetracycline. And figured out, yeah, we were having a really raging pink eye outbreak. So we started an autogenous program with Addison. By the time that summer had waned, it was too late to culture for that year, or too late to start the vaccine protocol for that year. And keep in mind, when you do send cultures off, it takes them about 2 months to make the vaccine for you. So if you start midsummer, late summer, you're probably just going to be gearing up for the next pink eye season. Picture of a calf here. I'm swabbing the cornea with just looks like Q-tip swab, and I stick it in this little slant tube and send it off to the lab, and they were able to culture for you and then grow the vaccine and actually can produce vaccine vials for you at your convenience, depending on, and the cost is depending on the lab and how many you need. For us, it's about $1 a dose is what we pay for this vaccine. Just a calf with a really bad pink eye lesion here. The cornea is obviously all scarred over from pink eye, and running the swab here, try to get a good culture to send off to the lab. This is what happens to a lot of the calves that didn't get treated in time or retreated several times. They end up losing their eye. This is a feedlot calf that we actually had to remove the eye on because the pink eye got too severe and the eye kind of burst, the globe burst, and we had to remove it for welfare issues. So again, a really tough issue in our feedlot, and we don't want to see these calves around in our operation anyway. They're outliers on our research trials. Obviously, it's a huge welfare issue. So that's why we went to our autogenous vaccine. This is just a report I got from 2019 when we sent the cultures in. This is the marxilla bovaculi strains. They cultured 3 different bovaculi strains, which again, we're not sure that's actually causing the pink eye issues, and they got 1 strain of marxilla bovis for us. It also tested positive for mycoplasma bovaculi, which they cannot make a vaccine for, but it's something out there that we need to do research on to see if the mycoplasma bovaculi can actually play a role in pink eye lesions. Okay, this is the one from last summer. So we went out and cultured again because you had to renew. We found marxilla bovaculi and marxilla bovis isolated from all 5 samples. So I sent 5 swabs in, and we got 5 marxilla bovis samples out of it. This is just a letter your veterinarian is going to get when your cultures start to expire, that you need to actually go out and reculture and send them back in and to make the next round of vaccine. So how did we implement that then? So we cultured our vaccine. So now what do? We went out and we gave all the cows and the heifers 2 doses after we got that first batch of vaccine shipped to the farm. Okay, went out and just hit everybody in early or late 2019, early 2021 or 2020. And then we started giving it to the calves at 2.5 to 3 months of age, a little early, but we wanted to start to hit them before the fly season started. We typically calve this time of year, and the flies start kicking in around May. So it's a good idea to give it early. Even though we have a little bit of risk of maternal antibody interference, we figured it was a good idea to start early because the calves are the ones that are absolutely hit the hardest with our pink eye lesions. And then we started getting our replacement heifers boosted at a year of age. So they got a dose as a calf. They also get boosted at 1 year of age, and the cows we give an annual vaccine in May when they get their pre-breeding vaccines. This is our treatment data, not a research study. Okay, this is just the cows that we've treated out of the whole groups. 2018, kind of a typical year that we've seen maybe an increased amount of animals, but not major. The following year, we had a huge amount of calves that we treated, 142, 115 cows. It's a huge percentage of the animals on the farm that we treated. We got the vaccine in 2020, okay, and then our numbers have dropped. Could it also be that the cows and the calves developed immune system responses on their own? Well, without the vaccine, maybe, could be. This year, 2022, the fly season is going to tell us, I guess, how well we're doing. We switched the vaccine up to a new culture, so we'll see if we get good protection. But this is what we did to dramatically drop the amount of pink eye cases we had on our farm. Just successful for us. It's not the same for every farm. Just the references I put in there. Oop. So with that, I have any questions? You guys want to drop them in the chat?
There's one here in the Q&A box.
So anaplasma, yeah, it's everyone bugaboo. Yeah, anaplasma is tough. The more I would say that we just finished, I just got a manuscript for a paper on some screening that we did on 4 herds in Ohio, and we found and these are herds that were suspect positive or known positive for anaplasma. And we found that 38% of the cows across those 4 herds were positive. So it wasn't 100% infections in those anaplasma cases, but they're there. So, prevention, number one, is going to be key, because once you get it in there, it's tough to get rid of. Prevention is screening cows that are coming in and bulls. I get that question sometimes too. I have a closed herd, and then I ask them, do you buy bulls? Well, yeah. Well, you don't have a closed herd if you're bringing bulls in. It can be brought in by any bovine animal. So screen those animals. I would strongly recommend you do PCR, which actually detects for the bacteria itself, not just ELISA. So screening for the presence of that bug, and the PCR is very sensitive for that. If they don't have any anaplasma on PCR, it's extremely unlikely you're going to spread it to their herd. So I would strongly advise you to do PCR on incoming animals. If you're buying bulls, buying some replacement females, prevention is really key. So screening for that. If you have it in your herd, you want to prevent it spreading, using swapping out your needles. Okay, use a new needle every time you give a shot for anything. Just swap them out. You're going to burn through a lot of needles, but they're not that expensive in the grand scheme of things compared to anaplasma spread. Tick control, really, really big. Cutting down on the number of ticks that are carrying blood from animal fly control is really, really important. If you have an outbreak, you can actually do some testing, try to screen out who the animals that are positive are in the herd and eliminating them. There are some routines out there, some regimens for using oxytet to try to clear cows systemically for anaplasma to cure them. Not a lot of research data out there that supports that. So it's kind of tough to get it out of your herd once it gets in there. You're gonna have to manage your way out of it, and keep an eye on the clinical cases, maybe feed some mineral with oxytet too, maybe bump down the issues. But again, that's my kind of spiel on anaplasma. We do have it in our own herds. Knock on wood, we don't see any clinical cases, so we kind of know it's there. It's not causing us an issue. So I'm hoping with the new advent of the new vaccines out there that have come from COVID, the mRNA vaccines, that we can get some beneficial anaplasma vaccines. There is one anaplasma vaccine on the market. It costs $8 a dose. There's no evidence that it helps, so it's not recommended to use. So, but I know there are some researchers out there working on some vaccines for anaplasma, because it is just a huge industry-wide issue. So,
a couple things in the chat there.
I gotta scroll down here. So we found only Zactran works for pink eye. So the Zactran is gabithromycin, so it's a similar drug to Draxxin. So it's the same class, it's a macrolide. We have gone to, in our herds, in my experience, we've used oxytetracycline as a first line drug. And if we don't see improvement in 3 days, or at least at least a stop of the spread within the eye, we will go to Draxxin. So Draxxin is kind of our go-to big gun. Zactran is very similar to Draxxin chemically, so I think you get away with both of those and they would work pretty well. Also, pain control, we give flunixin or Banamine, because those animals are pretty photophobic, and that UV light feels really bad on their eyes. If you've ever had an ulcer or an injury to your eye, it's super painful. And some of those animals, we will actually put a patch over their eye to keep the sunlight off it, or you can actually sew their eyelids shut. Your vet can do that for temporary purposes to allow that eye to heal. Scroll down here. So we have some manure compost piles that will breed flies. We are now using fly control minerals. Is there anything to use on manure piles other than just premise spraying? So spraying on the top of your buildings that are nearby. If you have a compost barn, spraying the premise out there to keep because the flies will actually hang out on the outside surfaces of the barn and the roof of the barn. If you spray that area, that can help get rid of the flies. You can feed feed through insect growth regulators. If you're actually feeding creep feed, or if you're supplementing those cows with a concentrate, you can actually do a feed through. But there is nothing that I know that you can actually inject or like pour on the outside of a manure pile to kill the flies. Spreading that manure pile out and drying it out is probably the best thing, and getting it out away from the cows. Endovac. Yeah, Endovac is basically a broad spectrum gram-negative vaccine. So Endovac is a vaccine where they've taken if you think of a tree, the branches and then the root, okay, and then think of that tree. That tree is basically the lipopolysaccharide molecule. That's the nasty part of a gram-negative bug, whether it's Salmonella, whether it's E. coli, or in this case for marxilla that causes pink eye. The branches of the tree, all different across the different species. The roots are generally the same, and that's what we have used. That company has used for Endovac. It's a core conserved antigen. We use Endovac for E. coli mastitis in cows. Some people use it for Salmonella protection. Really mixed results from the people. I have not used Endovac, but the vets that I know that have instituted on their herds, they've seen mixed results for helping pink eye issues. But again, like you said in your question, the grass was tall, all the rain, fly control is not good. That was the same issue for us on our herds. It's just a toughie. Remember, it's multifactorial. It's not a single issue. Any other questions?
Doc, what's the update on over-the-counter antibiotics? Is there still a timeline for some changes there? 2023,
when those are supposed to come in. So there's it's not new legislation. It's basically the FDA saying at some point, they're going to pull the oxytetracycline, LA200, biomycin, the topical antibiotics that we use in horses like Furacin, the cefacrin, dairy tubes that are non-prescription, that are OTC. They're going to pull them off the shelf. That's part of the push for antimicrobial stewardship. So not being able to buy those off the shelf, that's going to be part of their process here. I think it's 2023 is when those are coming off. So they're going to give everybody some time to adjust to that. They also need to have the drug companies adjust their labels so they can be reproduced for prescription use only.
And another question I've gotten 3 or 4 times this winter, mineral vitamin shots for newborn calves, whether it's selenium or some of the other products.
We typically use just selenium and then vitamin A, D, and E is what we use. And then we don't really touch the mineral injections too much in the rest of life. We put the mineral looks out there and let the cows and the heifers work on those. Obviously the steer calves are fed a ration, so we don't have an issue with that. They get direct fed. But vitamin E, A, D, and E, and selenium is typically what we use. We don't give any shots of multimin or any of those other products out there. One thing that we should be doing, and it's one thing that we haven't gotten around to in our own herds, and I know some really progressive beef and dairy vets do this, is they've done some mineral sampling from liver biopsies on cows. They're easy to do. You can do a little punch biopsy, put a cow in a chute, clean up behind the rib, and take a little shot behind the rib. You can actually send that liver off. Liver is the best thing to test for mineral status in your cows. And those samples can be sent off to actually look at trace mineral status. And in my experience, trace minerals are kind of overfed, especially in dairy cattle, but sometimes in beef cattle. And the best way to check for your status, if you have a dead cow or a couple of dead cows, if something happened, you could also send their liver off and check for trace minerals. And also you could have your vet come out and do liver biopsies, way better than drawing blood to check for mineral status. But again, we just typically, the calves get a bovis shot at birth, or whatever the product is, and a vitamin A, D, and E, and then they're good for the rest of their life. Generally, we don't do a lot of injectables after that. So,
question on foot rot treatment strategies. Foot
rot, yeah, generally in my experience, the bug isn't resistant to any of the drugs that we use out there. I mean, the Fusobacterium, you can cure it with penicillin, you can cure it with Exceed, Oxytet. You can even use the big guns like Draxxin or Nufor. Biggest issue is catching it quickly. Once you see them start to get lame, when that coronary band starts to swell up, when they start to toe touch, the quicker the better. Getting it dried out, it's key. I do not wrap any of those feet. If you have a calf that you bring up in the chute with foot rot, never wrap that thing. Make sure it's clean and dry. Give them a systemic antibiotic, that penicillin shot, XNL, Exceed, whatever you're using. Get them dry. I think dryness is really, really important, more so than anything. If we have a refractory case, one that doesn't respond to our first line antibiotic, then I'm going to pull that calf in, typically try some other vaccine, or not some other vaccine, some other antibiotic regimen. Sometimes I'll do some regional lymph perfusions where I'm actually giving antibiotics in the vein in the foot. And that helps them. Toe touch means they're walking on their toes, or three-legged lame. That's what I mean by that. So.
Any other questions for Dr. Kieffer while we got him here?
I saw the Ehrmonis. So Ehrmonis is a common contaminant. So Ehrmonis is not something that's going to cause a cow to die. It's probably just an accidental finding.
Anybody else? Stan, Dean, have any thoughts?
We had a local producer have a case of ketosis recently in a cow that was in pretty good flesh. Is that a fluke or an oddity, or is that something? He's obviously never had it before and really concerned about whether there was something he could have done to prevent it. Any thoughts on ketosis in brood cows?
Was this a cow that already calved?
No, she's due to calve this spring.
Yeah, so it's probably
doing just fine.
Yeah, I mean, I've fought ketosis for years. I'm a dairy vet by trade, so that is a huge issue post-calving in dairy cattle, usually due to cows that get too fat in the dry period. So, and I would imagine the beef cattle scenario where you're seeing it prior to calving, similar to where it is in sheep, where they get over-conditioned and they start to get a liver full of fat, and then you typically have to give them a bunch of propylene glycol orally to help them through that. There are some blood tests you can do to actually check for ketosis, but I would kind of look at the ration. If they're feeding, if they're getting this cow's too fat, that would be an issue. I think that's been my experience with cows, is getting them over conditioned. And sometimes on the dairy side, they calve in, and that's when you see the issue, or pre-lambing like in sheep, that's where you see the issue. And I imagine it'd be the same case in beef cattle. So nutrition is where I would look first.
Okay, thank you.
As a veterinarian, it's fun to blame the nutritionist for the problem. So
they were on good hay, and she was a cow that was in a little better flesh than the others. Not fat, but she was doing just fine, and that's what was alarming for her.
Yeah, it's not something I've experienced with beef cattle myself. Dairy cattle on a weekly basis. So
he seemed to see more cases of lepto in areas where there's high incidence of more deer.
do we see more of those? Is that what you're asking?
Yeah, is it more important to be vaccinating your cows for those strains of lepto if you have high deer populations around you?
I think it is. I think the lepto also circulates through a lot of the carnivores too. So the coyotes, dogs and things like that, and raccoons, omnivores out there. So all of our cows get lepto. Obviously, not everyone deals with lepto issues, but our cows are surface pond fed. So that's why I worry about leptospira. If you're feeding just well water out of waterers strictly to your cows, it may not be as big a deal. Whitetails, I'm not sure if there's any evidence that they can be vectors for it. I'm sure they could. Maybe I just never looked in the literature, but I know whitetails can carry BVD too. So, and obviously they carry ticks that can carry anaplasmosis. So, but I try to do my part, Dean, and cut down on the whitetails around. So, not always successful, but I'm not sure if there's any data out there for whitetails contributing to lepto rates, but. That's a question. Yes, we're vaccinating twice a year for Clostridial disease. So a 7-way twice a year.
All right, I'm not seeing any other questions. Go ahead and stop recording here. Doc, certainly appreciate you logging on here this evening. A lot of good information, and